In this video, we are talking about how diverticulitis can potentially impact the gut microbiome, so the relationship between the gut and diverticular disease. So what is diverticular disease, diverticulosis, diverticulitis? Diverticular disease or diverticulosis is a condition where pouches form in the large intestine. Diverticulitis, on the other hand, is when these pouches become inflamed. This can then result in pain, bowel changes, fever, and other symptoms. Check out our other videos on these topics. The inflammation associated with diverticulitis, particularly if it leads to infection or complication, it can disturb the gut microbiome, which is the topic of today's conversation. Sometimes you can treat diverticulitis with antibiotics, which further disrupts the composition of the bacteria in your gut. If you're new here, I'm a family medicine doctor, and on this channel, we talk about medical topics and lifestyle. So if that kind of stuff interests you, like and subscribe and stick around for the video. Maintaining a healthy gut microbiome is crucial for overall digestive and immune system function and health. When these disturbances occur, it can contribute to gastrointestinal issues, but also issues beyond, and it can potentially influence other aspects of health. With diverticulitis, on the other hand, which remember is different to diverticular disease, when there is an inflammation of the pouches, and this persistent or repeated inflammation occurs, then trouble can happen. So inflammation is just one of the many things that can hit our gut microbiome. It's important to understand that there can be other factors, medication, psychological things like stress, diseases, toxins. So these are all things that they can give a pronounced effect on the gut microbiome. And there's trillions of bacteria there, more than we have cells in our body, so it's good to get along with the gut microbiome. One of the things that can result in this is dysbiosis. So when you have persistent inflammation from something like diverticulitis, then you have dysbiosis. What is dysbiosis? Well, gut dysbiosis is what leads you to have increased intestinal permeability. You may have heard of leaky gut. You can check another video on that as well that we made. Dysbiosis, basically, it signifies the relationship between the gut microbiome and the host, which is you, the human. So it's not a classic infection. An infection is when you take a virus, for example, that does a certain bad thing to you. If you remove it and you put it back in that person, it'll do pretty much the same thing. It'll give you harm. But here, on the other hand, we have an imbalance, a dysbiosis. So an imbalance, which is too little or too much of things that we already have in our guts, they can manifest in different ways. So dysbiosis can present in different ways. So you might think of it as always being associated with gut issues, but maybe there's other symptoms that can present itself from dysbiosis, such as your skin, for example. So dysbiosis is a disturbance to gut microbiome homeostasis, so the equilibrium, and this is due to an imbalance in the flora itself, or in changes of its function, its metabolic activity, as well as how they are distributed in the gut as well. So what the inflammation does basically is that it messes things up. It disrupts, changes, and it impacts the gut microbiome, and then you get dysbiosis, and then you get further trouble down the road. There's 3 different types of dysbiosis. So one is a loss of beneficial organisms or bacteria. So it may be that the good bacteria that are meant to be there are just low in number, so they're depleted. In that case, we have to improve that. Another thing that can happen is there can be an excessive growth of potentially harmful organisms. So this may lead us to have to use some antimicrobial therapies to try and shift the balance in the other direction, to swing that pendulum in the other side. Then, finally, we can have a loss of overall microbial diversity. So we are losing a large amount of diversity in the gut, which is interesting because the more diverse things are, the better they seem. This isn't just in us humans, but also in the environments around us. So when we take away things, when we are less diverse, then the system itself, the ecosystem, is less robust and less beneficial to everybody around them. And in this case, it's you, the human. So these 3 things, they're not mutually exclusive either. They can occur at the same time, and most of the time they do. So think of dysbiosis as a loss of diversity or an imbalance, as opposed to something being there that isn't, like a virus. So this dysbiosis can occur in other areas as well. Here we're talking about the gut, but what about dysbiosis on the skin, or in the vagina, or in the mouth as well, the oromucosal area? So here we're focusing on the gut. A healthy microbiome needs to be diverse, beneficial, balanced, abundant, resilient, flourishing, healthy. So these are all the terms that we would associate with a healthy gut microbiome and not with dysbiosis. And what are some of the potential signs and symptoms of dysbiosis then? Well, you can have recurrent gas or bloating, you can have cramping, you can have increased mucus in the stool. So these are all gastrointestinal things that are going on. But you can also have brain fog, anxiety, depression, chronic bad breath, fatigue, irritable bowel syndrome. You can have sensitivities to certain foods. So these are all manifestations of dysbiosis. So sometimes you can think of dysbiosis as just in the gut, but also you can think of it as abroad as well. So one can beg the question of, what systemic diseases would you associate with dysbiosis? Some people would say, IBS right away. But what about other things? What if your eczema is a result of dysbiosis? Who knows? What if your fatigue and depression is a result of dysbiosis? Potentially as well. The same thing goes with the symptoms. So if I asked you, what symptoms would you associate with dysbiosis caused by, for example, diverticulitis in this case, in this video? Well, maybe you would think of diarrhea and things like that, gastrointestinal issues. But, maybe their skin symptoms are a cause of the dysbiosis as well. Maybe there is brain fog. Maybe there are food sensitivities. Maybe there's fatigue. Maybe there's something else. So this is just a nice way to think about things in a global picture and to keep that microbiome diverse and to prevent something like dysbiosis from occurring. If you like this video, please comment your thoughts in the section below, like and subscribe for more, and we'll see you in the next video.